Overall, the program is really about building critical mass for a biomedical um, technology industry centered on imaging. And so by having 10, 20 fellows, they're working, they come into the program. The first thing that they get hit with is basically, I would call very condensed courses or lectures. They're really able to sit down and hear about clinical problems from leading clinicians from Spain and Boston, and technologies from people established in those fields. And then they go through a sort of fermentation period where they talk to one another, talk to the colleagues in Spain and in Boston, and sort of put this together to pick out some promising directions. And they pick out promising directions of say, well, we can make an impact in this particular illness if only we could measure this in the body or image this in the body. And then they go about seeing whether they can pull together the technologies to do that. And by having the 50 to 100, and here's where the critical mass comes in, experts surrounding them, they can just poll those people and hopefully quickly come to a sort of yes-no decision whether that's a promising direction. Of course, many are not going to be ready yet, and they're going to have to be put back on the shelf and then move on to the next one. But then when there's a promising direction, the M+Vision program has the means to both help fund the research for a proof of principle demonstration of the methodologies and pool together the collaborators in Boston and Madrid that are needed to make it happen. There may be multiple steps that could only be done in a couple labs around the world, and the fellows need access to those labs. And then I think the final step is passing it on to a commercialization process and trying to form interested parties within Spain to form a small company and make the thing work.